Welcome to the Feels Club and a new therapy podcast where science, compassion, and real conversation meet. I'm your host, Mauricio Leguan, and each episode we dive into conversations around mental health and mental wellness with experts from a new therapy, Utah's leading mental wellness clinic. Our goal is to help you unpack, unravel, and demystify mental health and mental wellness. We do it by diving into a range of topics. Today's topic, ketamine therapy and ketamine-assisted therapy. We're going to unpack and understand what is available today and what could be available in the future, what to look out for, and what might be possible for you. Today, I'm joined by Tia Johnson, a family and psychiatric nurse practitioner from a new therapy. She joins us with her medical expertise to really learn about the transformative effects of ketamine therapy. We're going to uncover how this innovative treatment supports our mental health, brain health. It promotes neuroplasticity, which we're going to get into, and offer a pathway towards emotional healing, all while breaking the stigma around ketamine. So Tia, welcome to the podcast. So excited to have you here.
Thanks for having me, Mo. Thanks for the intro.
Did I do justice? Did I cover everything? I feel like you're a really important person at a new therapy.
Oh, it was more than enough. So
I'm really excited to dive into today's topic, which is demystifying ketamine therapy, trying to understand the science behind it. As I was preparing for today's podcast, I was looking at headlines, like what's out there, what's in the news. Okay. And I found some pretty interesting stuff that should come to surprise to people interested in this conversation and in mental wellness. Most recently, I know we saw Matthew Perry, famous actor, better known from Friends, died of an overdose. A lot of doctors and providers from that case have been sentenced to jail, some 2 years, some a few months, some home arrest. I've also heard of this ketamine queen, someone, I guess, from the underground selling ketamine to movie stars and famous people. This one I found interesting, and I want to read it. The fatal toll of ketamine is up 20-fold in the last decade. And there are many little articles from different areas of the world where people are overdosing, using it. I want to unpack all of that because those headlines, I think, paint an interesting picture. And if I'm being honest with you, I want to know what's behind all of that. So before we get into unpacking some of those, can you set the scene for us? What is ketamine? Where did it come from? Why is it, killing people basically? Where does it all come from?
So let's go back to the 1970s when ketamine first entered the scene. It has multiple uses. It's been used as an analgesic. It's been used as an anesthetic. And I wish its claim to fame was more for its use during the Vietnam War. It was termed the buddy drug. It helped get soldiers off of the battlefield safely, less pain, maybe a little bit less traumatic. So it's hard when something that is, in a lot of instances, very safe and effective gets a bad rap and gets known for being a horse tranquilizer or, a party drug when there's so much good that can be done and if it's done safely.
Yeah, that is so interesting. And I want us to go there, the gap between what you see it functioning as, right? And what other medical experts see it functioning as a drug to help, and to the ginormous jump to where it's like a party drug and it's causing death and overdosage and the misuse of it. So what does ketamine do to a person?
So let's kind of take a step back and talk, what it's doing in the brain. So it's working very differently than a lot of different medications, a lot of different treatments, even different from a lot of anesthetics that are used. It kind of protects your respiratory system, so you're still able to breathe safely when done effectively, when done appropriately.
Right.
So it was used for a sedative, and it's also been used for pain.
Okay.
Less fancy words, but
Yeah.
that's basically what it means. And now, of course, it's entered the mental health field, and it's helping with diagnoses like depression, anxiety, PTSD, just to name a few. The list
That's
does
why.
go on.
Yeah, that's wild that something that's meant to be an anesthetic or was used as an anesthetic to help with pain is now being seen as something that could help mental health. I want us to go there, but how does it also, and as you mentioned, people know it as a party drug. How does ketamine go from helping people to also being a party drug?
The helping and the hurting.
Yeah.
So loaded question, but basically it is the way that it is used, the way that it's framed, and how it's done. So when you talk about using ketamine in mental health space, you're thinking about the set and the setting. So if you look into ketamine therapy at all, you're going to see set and setting. Set means the mindset of the individual being treated. How are they coming in? Where are they at mentally? And then the setting, of course, is where are you doing this treatment? It needs to be set. It needs to set you up for success, right? Down to not only like the color of paint on the wall, but the people that are involved. Who's part of your care team? Do you have a therapist? Do you have a trusted individual that's going to be there assisting you as well with, just the grounding piece, the supporting piece, and then the safety side, the medical side of things, right? It's not just that therapeutic experience. There is monitoring that needs to be done for, your overall vital signs, making sure that you're responding well.
Yeah.
I said it's fairly safe, but you do have to have a healthy respect for the medication, right? You're still watching your breathing, your blood pressure, because it can do a little bit of a bump there. And then think about anytime you're feeling strong emotions.
Yeah.
This is going to enhance that.
Yeah.
We anticipate there being fluctuation, right? But we want to make sure that even though that we anticipate fluctuation, it's in a safe space.
So, I mean, if I can put what you're saying into other words too, like what I'm also understanding is like any drug, it can be used under medical supervision in an effective way to help an individual, whether it's pain medication or pain management, but also through this idea of mental health healing journey, which I want to get to. But to your point earlier, the misuse of it, the environment that you're in, the overdosing of it is what makes it, quote unquote, a party drug. Is that right?
Exactly. So when you think about using it on the streets or, outside of a clinical setting, you don't know what dose you're taking, right? So it could be excessive. You don't know what else it's potentially mixed with,
Sure.
which can change outcomes. You mentioned Matthew Perry. There are a lot of other medications involved.
Okay.
And then the setting, going back to Matthew Perry, you want to be surrounded by people who are supporting you, caring for you, coaching you through it, versus being around a body of water, things like that.
Yeah, a lot of the cases or the news articles that I was reading around like the death tolls and like the misuse and people passing away, a lot of it was around nightclubs, right? Like this person died at a nightclub or was misusing it at home or had an overdose or got it from somewhere probably unsafe, or they were mixing it with alcohol, marijuana, and other substances. So that's probably where it comes from, the party, right? Like obviously party meaning nightlife, alcohol, all those other things.
Well, when you're going out, you're seeking an experience, kind of looking for more of a euphoria, right? An escape. Whereas when you're doing it in a medical setting, it is very much not that.
Yeah.
Again, going back to set and setting, the mindset of the individual is very different in a mental health space versus going out on a Friday night.
Yeah. Can you, so obviously people are using it in those party settings because of that euphoric experience. So can you walk us through what's happening in the brain when someone is using ketamine?
Okay. Yeah,
both, I guess, like maybe, I mean, in the party scene, we're talking euphoric, looking for that moment.
Sure.
But like in a medical setting, like what is happening to the brain? I guess it may be in both situations, what's happening to the brain.
Yeah, and I'm going to derail slightly here just because I think it might clean up the response a little bit better. So mental health treatments, right? When you think about mental health treatments, you typically think Prozac, Paxil, Zoloft, antidepressants. Antidepressants are working on different chemicals in the brain.
Sure.
I'm sure you've heard of dopamine, norepinephrine, serotonin.
Yeah. Those like
So
things that are happening in your brain that people lack of or are looking for more with these drugs. Yeah.
Exactly. There's a lack of typically, and the reason that you're taking these medications is you're trying to get to an adequate level of, let's just use serotonin, for example.
Sure.
Can take weeks, right?
Mm.
It takes weeks for something to build up. So for the first couple of weeks, you're like, okay, am I tolerating this medication? I don't really feel any different.
Mm-hmm.
I'm doing okay with it. A couple more weeks, those levels are rising. Are you feeling better?
Mm.
Are you less depressed? Are you feeling more energized? Is your mood changing? Takes time, right? Because you're waiting for those to bump up in the brain.
Mm-hmm.
Now switch to ketamine. It's working on a completely different pathway. It's working on glutamate, which is an excitatory neurotransmitter in the brain.
Okay. I kind of understood that.
Okay. Trying to simplify. So the glutamate in the brain, again, completely different chemical, different pathway, different mechanism, is working on the, let me make sure I get this right, the BNDF, which is the brain-derived neurotrophic factor.
Mm.
In more simple terms, it's like the fertilizer of the brain, and it's involved in supporting learning, memory, even emotions and mood. It can be, the BNDF can be low in people with depression or mental health conditions. So with that fertilizer of the brain, it's helping with growth, new connections, new pathways. Another big buzzword you already mentioned was neuroplasticity, right? So that's kind of insert neuroplasticity here. I do this a lot during my consult, like the new connections, right? That visual, you can see those neurons making new connections, maybe healing old ones, repairing those. And that's when you're in a more malleable neuroplastic, right? Plastic state, where a lot of times with mental health, there's a lot of rigidity to thoughts, right? You feel like you can only think one way, feel one way, respond one way to things, very rigid. The neuroplasticity gives you more flexibility, right?
Okay.
You can think outside of these default settings you might feel like you have. You don't have to think that way. You don't have to feel that way. You don't have to respond that way. A good visual, now that we're maybe going to get some snow here, is let's say that you enjoy winter sports and you are going to, you're going to go skiing. You're the last one on that lift. It's a busy day. You look down and you see all of these pre-created paths, right?
Sure. Yeah. Everyone's been going down the hill before you. Yeah.
Chances are you're probably going to say, hey, they kind of knew what they were doing. I'm going to just keep going along with that, right?
Sure.
Default mode, you're just following that. This deep-rooted, let's do this. Now think about, okay, today, maybe it's going to snow. There's a fresh coat of snow. You're first on that lift. You're first on that mountain. Blank slate, right? So it's kind of those new connections. Not that default, I have to respond this way, I have to feel this way.
Sure.
Less rigid. You have options, and you get to choose those options. You're taking a step back. There's that pause, right?
I'm fascinated. I've heard the word neuroplasticity. I've used the word neuroplasticity before. And the way I have understood neuroplasticity is this idea of like that we can shift the way we think, process, that like, and I've used talk therapy a lot, transparently. And like in talking to people, to therapists, to professionals, they mirror back to me like what I'm saying, or they may offer a different perspective that opens my ability to change. That ability to change is what I've called neuroplasticity, right? It's that my brain, or our brains as a species, has that capability. What you're saying is that not everyone has that capability, right? And depression, anxiety, and other mental illnesses impede us from doing that. Ketamine is that new coat of snow that is allowing that person to build new ways of thinking, allowing them to mold their thinking, their processing, their behaviors in a different way where they maybe were stuck doing it before.
Absolutely. And thank you for sharing the talk therapy piece.
Yeah.
It goes hand in hand. Ketamine and talk therapy really work
they can go hand in hand
together. Well, think about during therapy, giving you new approaches, new thoughts.
Sure.
Sometimes we're so rigid, even though we're ready for change. We want to feel better. It's hard to change just that wall, right? We're rigid, it's stuck.
Right.
It can help the flexibility, like, okay, kind of pull that wall down. giving yourself the opportunity to do more processing,
Sure.
more integration following.
Mm-hmm.
So I had a therapist tell us at the NU team, they felt like one treatment with ketamine was like a year of talk therapy, right? Just
That's
because
wild.
the fog can be removed, and what is it revealing? All of a sudden, these things that people are like, oh, I've been trying to get to that, right? I've been so stuck. Can become unstuck.
That's so cool. Because I think if I could akin it to something else, right? Like exercise, right? Like there are people who, I don't know, exercise and they got it. Like they build muscle easily, they lose weight easily. And then there's the, subgroup of people who just have a hard time. And there are other medical interventions that can help that person lose the weight or gain the muscle, right? That's basically what you're akinning this to, is that for some, talk therapy alone can do a lot in their mental health journey. Others might need assistance from something like ketamine or other drugs to help meet the need that they're lacking.
Exactly.
That's so cool and amazing that the science is getting there. You mentioned earlier that ketamine's been around since the 1960s, 70s?
70s, yeah.
Why is it more recently that we're seeing it move into this mental health space versus like, I don't know, 40 years ago, 50 years ago?
Yeah, so there are a lot more studies being done, so a lot more research backing, and even though it's not, let me back up. The intramuscular or the IV infusion ketamine treatments, even though it's not FDA approved, it's very well backed by a lot of literature, a lot of studies being done. And then at ANU, we're seeing our patients' responses are aligning to the literature.
Can people become addicted to ketamine? Is that part of the fear, maybe why for so long it was not used in this space? Like, right, it's been around for a minute, but it has been used. Is it because people are afraid of people being addicted to ketamine?
Yeah, well, and it's a valid topic to bring up again because of all of the headlines you shared at the beginning here. There's definitely concern. I think during all of my consultations that something comes up. Am I going to get addicted? Am I going to be addicted to this? Am I going to need more and more of this? The way that ketamine works, again, we talked about the glutamate, completely different pathway. It's different than opioids or things that are typically more concerning for addiction. It's working on a completely different pathway, and it's less of that reward side of the brain. There is still, of course, concern when patients or when people are seeking euphoria, right? Because there can be a bit of a dissociative experience with ketamine.
Okay.
Very low concern when, here I go again, the set and setting is appropriate. You've got the right care team in place. You're going in a completely different mindset.
Sure.
And it's structured, it's limited. You're not doing it consistently for a long period of time. And each one you're going in with an intention and with a focus. You're coming out, again, the integration piece, focusing back on the reason you sought treatment. And we do a really good job as well, which I would hope most providers that are offering the service do. Screening, preparing, talking through that. If there's any concerns, we're talking through. There's different screenings you can do along the way too, to ensure that, okay, cravings trackers, things like that.
Sure.
But it's a surprisingly, with again what you shared at the beginning, a very low risk because
Under the
it
right
just
care.
works so differently.
Yeah. That is. Yeah, I mean, that's helpful. I didn't know there was a difference between being addicted to something like an opioid drug versus being addicted to something like ketamine, right? Like you're explaining that there are two different parts of the brain that it's getting towards, or it's not activating the same addictive
Right. It's more just
receptors.
where it's targeting what it's doing in the brain is very different. And because it is time limited, it's intention focused, it's medically monitored. Very important, right?
Medically
monitored.
Yes.
You're in a facility where you are surrounded by a team that has your best interest. And then, of course, we're taking companions. So
Sure.
whoever is a trusted individual in that that person's life as well, right? We're trying to really build that support system. So it goes beyond just those treatments, what's happening from there, the integration piece, you're really going to maximize the experience that way. The focus is completely different.
You mentioned hallucinations. I know people wonder, like, will this drug make me hallucinate, maybe lose control? What is it doing? Is it making people hallucinate? Like, is it a loss of control?
Loss of control. Sometimes we want a little bit of a, what do we say, the rigidity.
Sure.
People are white knuckling it, holding everything
Yeah.
together. Sometimes that loss of control, we want to kind of switch the narrative. That can be a positive thing when there's, let's say that it's more of a relaxation.
Okay.
Not a complete loss of control, but
Sure.
you can let those walls down, right? Allow yourself to feel those emotions, experience those things versus I'm keeping it all together, I'm holding it all in, right?
Right.
There's
yeah.
a benefit to that.
There is, yeah. Especially when, like, to your point, right? Like, where our mental illnesses, our depression, our anxiety, our PTSD is a barrier for us to, live our lives or do the thing that we want to do. Then, yeah, like something that could help break down those walls would be helpful, right? Lose control, I guess you could call it lose control. You could say,
Yeah, as long as you're saying it in a positive way.
Sure, yeah, yeah.
Because it can be a very good thing.
Mm-hmm.
And then hallucinations. So there can be a dissociative side effect from
Okay.
ketamine. And sometimes, let's talk a little bit. I'm sure you've heard about id and ego. It is more impulsive, right? Ego is that reality, stick to the plan, right? Sometimes we want that. We need that little bit of a ego drop, right? And that's where you can get into that different space, maybe make some realizations that you were otherwise just walled off from
Sure.
ever experiencing. I wouldn't necessarily say, yes, you are going to hallucinate, but that is absolutely a side effect of the experience, is a dissociative experience, which is why, again, you want to make sure that you are doing treatments in a safe, controlled environment where everyone around you has your best interest at heart.
Totally. And I'm hearing loud and clear from you that the setting in which you're doing it, the providers that are providing the care are really important. And what I love about a new therapy, and I've been into your facilities, is that it is that space, that welcoming space. And clearly the team there, largely led by your care, is attentive to understanding the patient even them walking into the clinic, right? And your assessment of them, is this the right move, to like the entire experience from walking into the room, what does the room look like? And I'm like recalling like those calm vibes that you get when you walk into one of the rooms at a new, the comfort and the attention to those details, so that when you are under the treatment, you are in that safe space to be able to make those changes that you're looking for from a drug like ketamine.
Yep.
Kudos to you all on the team.
Well, and you nailed it too. I always say during my consults, the before, the during, and the after, equal parts important.
Yeah.
So from the drive over to the clinic, that first, you're meeting the person at the front desk, all of that, right? You kind of bring a lot into the treatment. Even if you're like, okay, I'm ready, I'm relaxed, I'm doing this. It's really hard as humans, right?
Yeah.
I've yet to meet anyone who's like, I love the unknown. It's so comforting. It's so relaxing.
Yeah.
Bring it, right? You're bringing stuff regardless of being completely ready for healing. You want to make sure that your team is right there with you. And the environment absolutely is a relaxing, calming one. That being said, you can only trick yourself so much that you're not in a somewhat medical setting.
Yeah.
So we still are absolutely paying close attention to those types of things, but trying our best to make sure that it is a healing environment where people can feel safe, secure, grounded the entire time, whether it be, they're doing it independent, they have a companion in the room, there's a therapist there. Our team is always 100%. They know that if any one of the team members is entering that room, they're enhancing that experience and ensuring that patient feels safe.
That's awesome. Let's talk a little bit about what can people go to ketamine for, right? We've talked about a couple of diagnoses that could potentially be resolved with ketamine. Can you walk us through what conditions can benefit from using ketamine therapy?
Yeah, so kind of high level, again, not FDA approved in a lot of these spaces, but lots of literature backing lots of successes. Depression, I would say, is the number one that at least we treat and we see. Anxiety, PTSD. There's some people will receive treatments for chronic pain, eating disorders, OCD. The list kind of goes on and on.
It's a pretty wide range.
Yeah.
With just this one drug. Can you walk us through what does a typical treatment? So we've obviously started to unpack a little bit of like what does the space at ONU look like, but walk us through what does a typical treatment session look like for someone who's new to it? Like what is the experience?
Day
You walk in
one,
through the
treatment
door.
one.
Yeah.
Okay. So you will have been medically cleared by a provider before stepping foot in, just ensuring that, again, you want to make sure that you are a good candidate for treatment, but also a safe candidate. So there's a lot more to it than I have a diagnosis of depression. Okay, come sit in this chair for treatment, right? There's a whole lot going on before that.
Yeah.
So we're ensuring safety, going over, preparation, mentally being ready for the treatment is important as well. We want to make sure that there's a good care team in place. Therapist, right? Hand in hand. And then you will do a couple hours of fasting prior to. Unfortunately, one of the main side effects people can experience is nausea, vomiting. Not everybody does, but we're going to try. If we can avoid anything uncomfortable during treatments, that's what we're going to do. So
For sure.
we do ask that patients fast prior to and really hydrate well because it helps with the experience, the recovery. And then once patient is on site, we'll get them into one of the private treatment rooms, lounge chair, say bring pillow, blanket, comfort item, whatever is going to make you feel safe, secure, grounded during that treatment. Have at it, bring it, kick your shoes off, right? Eye mask. Sometimes people feel it allows them to go a little bit more internal if they have that eye mask on and they feel like they're kind of in between things. Open your eyes and you see a new, you're like, okay, kind of pull yourself from the experience.
Sure. So that eye
kind of
mask can help.
be helpful, yeah. A lot of people swear by the music. So music can help guide the experience. We have playlists that were thoughtfully created and really can help guide the experience. So you have the opportunity to listen to that. And you can listen to that if you have a therapist in the room, just at a lower volume, of course. So you're not missing out on anything. You're still creating that space for yourself. And you can have a companion in the room. So if you say, hey, this is my person, I feel grounded with them, I feel safe with them here, perfect. They're in that room. We rearrange the furniture. If therapeutic touch is helpful for that patient, that person sitting right there, following the patient's lead, of course. They're calling the shots during treatment with every move. But they're creating that space. They're stuck with us as providers, of course, but otherwise they're deciding what's going to help them get the most out of the treatment.
You don't have to go in it alone.
Absolutely not.
Yeah. I mean, clearly they're not alone. They have a medical team that's there to take care of them. But from like the vulnerability that one experiences as you're going through that mental health journey with the drug, you can have someone there to ground you and make you feel secure. What does it look like when, are people talking? Like when there's a therapist in the room or a loved one in the room, like, are they processing out loud with them? Like,
that's a tough question. And I hate this. Everyone's so different. Everyone's so different.
Yeah.
You may have, I'm an external processor.
Sure.
I'm going to jab, right? Very chatty. Whether someone's in there or not, probably. I'm going to be talking. Some people, it's more internal, right? It's more personal. Even if they have someone in the room, they know that. Maybe that's just keeping them grounded and they're just able to experience, right? There might be some integration going on, though. There might be some conversations. Anytime there is a therapist in the room, there's a pre-consultation or pre-meet, right? Making sure that the patient's wishes are being honored. If they want to have conversation during, or if they say something, or if they just say, okay, I want to just have you write this down. I don't want to forget if I do say anything, but I want to talk about it later.
Sure.
And sometimes the patient says, I have no idea what I want. I don't know if I'm going to say a lot. I don't know if I'm going to be emotional. Maybe I just, sit in silence and in the experience. Totally normal. All of that's totally normal. And each experience can be different too, right?
Yeah.
Maybe one time I'm in there and I'm chatting up a storm. I have so much to say. I'm experiencing all of these things and I want to say it aloud. And maybe another one it's more internal, more personal, and I'm not saying a thing.
Yeah.
Equal parts important, equal parts and equal parts normal, right?
Yeah. 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 I mean, it truly is like everyone's unique experience. So when you walk into the room, you got cleared to do it. They're a great candidate. They have their appointment. The medical provider, they might be coming with someone. The therapist might meet them there. The medical provider comes in. The drug is administered through an injection, as if I'm understanding correctly.
And before that, again, just hitting on the safety piece again, we do have patients wear a real discreet monitor just on their wrist and 2 fingers, and it's giving us live feed of their vitals the entire way through. I don't remember if I've already mentioned it can give a bump
Yes.
to the blood pressure.
Yeah.
So we're watching that closely. We check vitals before. We wouldn't move forward with treatment if it's not in an adequate range, and then we're watching it throughout. We wouldn't administer a second dose. We certainly wouldn't discharge home, again, until we see everything's in a safe, adequate range.
And then injection, I guess then at that point, how long are they in the room? Like you come in, you do all of those things, you administer the first dose, 30 minutes, 40 minutes, I don't know, an hour?
Yes. The appointments are typically set for 2 hours.
Okay.
The first 30 minutes, give or take, it can vary, especially after the first treatment. You might need the full 30 minutes to kind of prep, get intentions set, make sure everyone feels ready to move forward.
Yeah.
So first 30 minutes, give or take, we're asking a series of safety questions every time, getting vital signs, getting you set up. Dose is based off of weight, so we do that in that first 30 minutes as well. Setting up pillow, blanket, whatever the music playlist, making sure that everything's ready to go before we move into the medication administration portion of the visit. But we want patients under the medicine for about an hour. Okay. Give or take, right?
Right.
So after everything's set, patient says, let's do this. We're ready to go. It's the way that we administer it at ANU. The route is intramuscular. So like a flu shot, right? Into the deltoid there. And it's given, typically kicks in about 2 to 5-ish minutes.
Oh, wow. Pretty quick.
Typically pretty quick. Sometimes quicker. So I say typically.
Yeah.
Everyone's different. In 2 to 5 minutes. And then typically it will peak and run its course in about 30.
Okay.
Typically. And then as providers, we administer, make sure everything looks good, and we back away and we allow that patient to have their experience. We only interrupt if there's something that we recognize needs addressing, or if the patient presses the call button, or we try and allow and not disrupt the experience.
Yeah.
But we do a really good job of coming in punctually, promptly at that 30-minute mark between, as that medication should be wearing, right? That's the rise and the fall of the medicine. We shouldn't be interrupting, but sometimes people metabolize things differently. If they still are in that space, we back away and allow them to continue.
Sure.
If they feel they're becoming more lucid, we're checking in. You're at ANU. It's been 30 minutes. Try to reground, right? Oftentimes with ketamine, you're going to say, was that 3 minutes? Was that 3 hours? Hey, you're at ANU. Vitals look great. You did great. If the patient chose to maybe do the first 30 minutes independent, we'll offer, hey, your companion's in the lobby if you want them to come back and say, hey, or giving, again, what's going to make them feel safe. What do they want in that moment?
Sure.
And then we ask some guiding questions, kind of see where they're at. And as I said, we want them under the medicine for about an hour. There's opportunity now for a second injection.
Okay.
And so it's rinse and repeat at that point. As far as the process, right? The administration, kicking in, running its course in 30. As far as patient experience, it's not like you're pressing pause and hitting play, right?
Okay.
The first 30 minutes compared to the second 30 minutes,
Yeah.
they can be very unique experiences to themselves, right? I think it's important to mention too, some experiences can be very light, uplifting, profound, beautiful. You feel like you're in complete remission from symptoms. In fact, a lot of the literature shows ketamine is a good urgent emergent treatment when there's risk of safety, right? Because oftentimes patients can feel full relief of symptoms within like 4 to 72 hours of treatment. Is it long lasting? Not necessarily, but to give that patient that relief and the understanding of I can feel this way, I think is very important. But then some of the experiences can be a little bit darker, a little bit heavier, just depending on what emotions come to the surface. Again, switching that narrative, don't say that this is a negative thing. Oh, that was horrible. I feel so uncomfortable. What are you going to do what are you going to do with those emotions once they come to the surface, right? You want to be able to process, integrate. Great therapists involved, right? Working through that.
Discharge from that point. They go through the second round. You come check their vitals. You make sure they're okay to go. Do people, they can't drive home. Like what does
Right.
that discharge segment look like then after that hour under the drug?
Yes. So remember, they've had that continuous monitoring. We've been watching that closely. If all looks good after that second 30 minutes, we'll remove that device. We're offering patients snack, water, hydration is key, but they're listening to their body. If they're up for it, absolutely. If they need a little bit more time, honor that. And sometimes, so it depends on where they're at in their visit. Sometimes people say, I'm ready to get home, get into my own bed, relax. Perfect. If you've been medically cleared, you're going home with an adult trusted individual, right?
Yeah.
And we don't allow rideshare. We want to make sure that we're kind of saying, hey, tag, you're it. If Mo needs extra help getting to the couch when he gets home, right? You're that handhold, or kind of catering to your needs for the next couple of hours. And you're not driving for the rest of that day, and low stimulation for at least the rest of that day.
Wow. That's, very thorough process and very safe process, right? Like thinking of like any medical setting, right? Like you do want your team to be very present and very aware of how you're doing before, during, after, like, right? Like everything you mentioned. There's been a lot of discussion around at-home ketamine therapy and ketamine services. Based on everything you shared with us, what are some of the concerns or safety concerns with doing it at home? Like I can think of probably at least 5 pitfalls that could happen if you're doing this alone at home. But clearly some providers are leaning into that model. I think I saw a headline recently that there's some risk involved, and we're kind of determining what that risk is and who's liable and what does that look like. So like talk to me about that model and some of those safety concerns.
Yeah. And I think I've hit on it so many different times throughout just how strongly I feel ketamine is a scheduled drug, right? Again, having a healthy respect, although it is fairly safe, especially when done right, you still got to respect the medicine and respect that experience medically and mental health wise. There's so much to be said again about the set and setting. And if you don't feel like you have that completely set up, it can really impact the experience. Vital signs. If you haven't been properly vetted, you're doing this at home. Who's coming to your rescue, right? Who's regrounding? And oftentimes when you're in that dissociative space, there can be some scary emotions that come up. Sometimes you're wondering, okay, am I breathing? Sometimes just having the right person there to reground you and remind you, we're monitoring your vitals. You're doing great. Take some deep breaths. Let's kind of recenter, right? If you're in a uncontrolled environment, there's a lot less of those safeguards in place, and it can make for a really uncomfortable experience.
Sure. And those safety concerns become more glaring, right? Like I can imagine if someone is experiencing an acceleration in heart rate or blood pressure spiking, like if you're alone, how do you help yourself, especially if you are in a dissociative state?
Exactly. And have you talked to anyone? Does anyone know that you're having that
that
experience,
you're
checking
administered the drug?
in, the follow-up, and we've had patients who have panic attacks, right? Those big emotions coming to the surface. Having the right team in place, the right people there, it's so incredibly important for that experience as well. So not just the medical side of things. It really is all of the above needs to be really well managed, well maintained. Otherwise it can, I'm sure you've heard the term K-hole, right? Which is typically more often in the party scene where You have no idea. You don't have that person that's watching over you, making sure that you're safe, that you're secure, that, if you're experiencing a big emotion, something scary, they're able to reground you.
Yeah. I mean, it helps understand too, like, I mean, I love that it's an emerging treatment. It's more accessible than it has been before for mental health treatment.
Yeah.
I can see why it's not necessarily offered everywhere at this point. I hope one day that maybe it's more accessible than it is now, right? I think more literature is needed, more science, right? I think the FDA approval would probably kick it into that next level where it would allow more people to access it. But at the end, what I'm hearing from you and what I'm learning from you is that the setting, the environment that you're in, the team that's providing the care for you is still extremely important to maintain the safety of the drug, because there is a slope where it can get dicey, but with the right team in place, with the right medical supervision, it is an extremely safe drug to use. When people think about finding a clinic or finding a place to receive the care, obviously a new therapy would be a wonderful place to land, but what should patients or people interested in trying ketamine look for in a clinic to see if they are a trustworthy provider, to know that it's a safe medical environment? What should people look for to make that decision?
That's a good question. And really, you want to make sure that if anything feels rushed, slow down, pause, ask all the right questions. Okay, medically safe. If no one's asking about your medical history, pause. Your surgical history, pause, right? Those are things that you want to make sure that are being covered. Because again, we're using it in the mental health space, but it has medical risks and side effects that you want to make sure you're screening for. And then back to the medical side of things, there are certain diagnoses that it wouldn't be appropriate for even in the medical field to use, or ones that you want to make sure you're really vetting out the symptoms, the control of those symptoms before moving forward. It may be an appropriate treatment. It may not be an appropriate treatment in that moment, but we can get to that point. So you want to make sure you're meeting with someone who's being very thoughtful and very intentional in the plan, not just you've checked 3 boxes, let's get you scheduled for tomorrow, right?
Yeah.
Make sure that you understand the process of, the treatment course, the series. How is it being administered? How am I being monitored throughout? Therapy is a huge piece as well. I know I've said a couple of times that it's not necessarily a requirement, but understanding, do they have that type of support? Maybe not, a ketamine-assisted psychotherapy session, but if there's opportunity for integration, is there someone on the team that's equipped to do those types of things?
Yeah.
Like just asking those questions and being really thorough with the entire picture, not just let's get me through the door, which is hard when nothing's worked. People are close to losing hope and they've okay, I've heard about this and I think it's going to be helpful to me. They can get me in tomorrow. I want to feel better tomorrow. Let's do it, right?
Yeah.
Still just got to pause and make sure it's the right approach,
Totally.
the right treatment.
And that's such a valid point, right? Because you are already in a vulnerable state. Like if you're seeking this as an alternative to other drugs or as a last resort treatment to help you, you're not necessarily in the right headspace. So it goes back to, if you're listening to this podcast, if it's you or if it's someone you love or if it's someone you care for that you feel like could use the benefits of ketamine, to be that person for that so that you can help advocate, right? You're not in this alone. And I hope people don't feel like they're in this alone. I wonder, what's one thing you wish every patient understood before taking the step to take ketamine therapy?
One thing. That is a hard question.
Yeah.
Just how different the experience can be for everyone. So if you go on YouTube or you listen to someone or a family member and you hear their experience, grain of salt, right?
Sure.
But it's going to be unique to that individual, and you really just have to trust the process, knowing that you may have this really beautiful, profound experience out the gate, but those harder sessions, equal parts important. I may even argue and say they're even more important as long as you've got the right team in place to help work through that, right? You
Yeah.
don't want to sit in that space. But that's what I think is a lot of times we'll have patients come in who have heard XYZ is going to happen. I'm going to have this happen. It's really tough to say, right? We're not guaranteed anything. Is it a great treatment? Does it work for a lot of people? Absolutely. But if you anchor to any one thing, like that's what I want, pull back, allow it to run its course, trust
Yeah.
the process.
With that, curious, like what concern do a lot of the patients that go through this express before or during their first consultation? Is it like, I mean, you mentioned a few already, right? Like, am I going to get addicted to it? Like, am I going to lose it? Like, are there other concerns that patients bring up when they are consulting with you about ketamine?
I think one of the hardest ones that I hate hearing is, and it's getting to the point of I've tried however many different medications, they've done nothing. Will this work for me? I need this to work for me. Can this work for me?
Mm-hmm.
Which is so hard to hear. You want to be able to give a guarantee,
Yeah,
right?
like for sure this is going to help you. Like this is the
Yes.
thing for you. Yeah.
Which I can't say, right? Everyone is different. But if you're doing things in the right way and really working alongside the treatments, there's benefit to be had. And it may look different than what people are coming in thinking they're going to achieve, but
Yeah.
there's a lot to be gained from it.
And to your point, right, with the right team in place, the right care, the right attention to those details, like the likelihood of this working for you is also increased, right? Like if you're approaching it the right way, if you've been cleared with the right, intake, and you have the right team in place, you have therapists or loved ones, like whatever it is that you want to opt into. And then, so those options are given to you, but then you also have the right structure in place.
Right.
That does seem like it increases the chances of this helping you out in the long run.
Well, in understanding, it is not a passive treatment by any means, right? And the work doesn't stop after that 2-hour appointment time.
Sure.
It's just getting started. I think we live in a world of instant gratification, right? Where you're like, I want to feel better and I want this right now. We want that too. I want people to walk in and feel better the next day, but there's a lot of work to be done. And once you're in that more like flexible space, what are you going to do with it?
Yeah.
Right? There's a lot of the integration piece that comes into play there.
Yeah.
To really help with the durability of the treatments.
That's so fascinating and exciting. Yeah. I feel like I've learned so much, and I feel like I'm going to go back and listen to what you've said and like unpack even more. So Tia, I just want to thank you for explaining what can be so scary and unknown really. I don't know what other word. Yeah.
No,
like
it truly is.
and mysterious, right? And as we've talked, the science is evolving so quickly. There's more literature. There are obviously places like A New Therapy who are using this, gathering your own data, seeing your own experience with your patients of the benefits and the help that this can offer. What excites you the most about where this field is heading, where ketamine assisted therapy is heading, where this drug and the possibilities of it helping people on their mental health journey? What is exciting you the most?
So, as you mentioned in intro, I went to school and I went initially and became family nurse practitioner. Did that for 10 years. Got into the mental health space a couple years ago. And the minute I saw the transformations, these really beautiful, prolific experiences, these patients coming in, shell of a person, and then seeing the transformation, I said, I want to be part of that. I want to do this. Forget family medicine, right? I mean, I love it. But being able to see the potential. I failed to remember your question, but what I'm excited about, I think is what we were talking about, is the opportunity for more patients, for more people to experience actual relief, getting back to living their life, not just a lot of medications. They feel like, okay, I feel more human. You want remission. Goal is remission, and goal is quality of life.
Yeah.
Right? Versus, well, I've made it through the day.
Sure.
It was better than yesterday. I felt fine-ish. No, thrive.
Yeah.
Goal is to thrive.
That's so exciting. And I do find that fascinating from your experience. We didn't get to talk a ton about it, but your approach, everything you've shared with me, I can see very clearly how your approach is like a family, a PCP, right? Like you're
Right.
approaching it from like the holistic person. What is your history? What do you care for? Like you're looking at the person on top of the psychiatric care, right? I think oftentimes we do approach that psychiatric care as like a separate issue from all the other things that are happening in your life, your eating, your
Mm-hmm.
well-being, your support system. Like, are there other structures in place? And I think not just a new therapy as like a facility and a provider, but you, Tia, as a nurse practitioner, your approach is very much so stemmed from that place of caring for the whole person. And it excites me that there are providers like you administering this drug, seeing what it's capable day in, day out, and
Yeah.
helping individuals and hopefully reaching more people for those positive effects of what ketamine can do for them and in their journey. Help them go from not thriving to literally thriving, right? Not just surviving or mitigating your mental illness, but really flipping it on its head and saying, like, I want you to be a thriving individual
Yeah.
who happy and doing the great things that you
Not
want
just
to
good
accomplish.
enough.
Yeah.
Yeah. Well, and you want to remove the tunnel vision, right?
Mm-hmm.
Looking at that person as a whole versus a diagnosis. You're
Yeah.
looking at all of the different symptoms and what makes that person who they are and where they're at
Yeah.
and how can we get them
That's
to
incredible.
remission.
Tia, I want to thank you again for your time today and for demystifying, unboxing, like unpacking some of the science behind ketamine. I have a feeling that this isn't the last time we're going to chat about this. There's so much more
So much
to
more.
unpack, to experience. So I look forward to the next time we get to sit in these chairs and chat more about what is possible with ketamine therapy. So thank you.
Love it. Thank you.
Well, thank you for joining us on another episode of the Feels Club and a New Therapy podcast. For any of you out there who are interested in learning more about a new therapy, ketamine assisted therapy, or any of the emerging treatments that are available at Anu, please follow us on social media, follow this podcast, or visit us on our website at anewtherapyutah.com. We're so excited to continue this journey of sharing not just the care, the compassion behind our care, but the science behind it. So if you have found this helpful or you know of someone who would find this helpful, do us a favor, share this podcast, share this video with a loved one, with someone that you know could use the help. If anything, we hope that you have found a glimmer of hope that you can start anew on your journey towards healing and thriving.